Glucose tolerance tests. Have you ever wondered how your body handles sugar, especially if you have concerns about diabetes or blood sugar levels? The glucose tolerance test, often referred to as the GTT, is a valuable medical tool used to assess how your body processes glucose, a type of sugar. What is a glucose tolerance test? A glucose tolerance test, or GTT, is a medical examination that measures how efficiently your body processes glucose, sugar. Glucose is the primary source of energy for your body's cells. To maintain good health, it's crucial for your body to regulate blood sugar levels within a specific range. Why are glucose tolerance tests important? Diabetes detection. One of the most significant reasons for conducting a glucose tolerance test is to diagnose diabetes or prediabetes. Diabetes is a chronic condition that affects how your body uses glucose. Identifying diabetes early allows for better management and can help prevent complications. Gestational diabetes. For pregnant individuals, a specific form of the glucose tolerance test called the oral glucose tolerance test, OGTT, can determine if they have gestational diabetes, a temporary form of diabetes that can develop during pregnancy. Common glucose tolerance tests. There are a few variations of glucose tolerance tests, but the most common one is the oral glucose tolerance test, OGTT. Here's how it typically works. Fasting. Before the test, you'll be asked to fast overnight, usually for about 8 to 12 hours. This means you shouldn't eat or drink anything other than water during this time. Baseline blood sample. When you arrive at the testing facility, a healthcare provider will take a small blood sample to measure your fasting blood sugar level. This provides a starting point for the test. Glucose drink. Next, you'll be asked to drink a specific glucose solution. It's a sweet but concentrated solution containing a set amount of glucose. Monitoring. Over the next few hours, usually 2 to 3 hours, several blood samples will be taken at regular intervals. These samples will help track how your body processes the glucose from the drink. Interpreting glucose tolerance test results. The results of a glucose tolerance test are typically presented as a graph showing how your blood sugar levels change over time. Here's what the results may indicate. Normal. If your blood sugar levels remain within a healthy range throughout the test, it suggests that your body can efficiently process glucose. This is the desired outcome. Prediabetes. Elevated blood sugar levels during the test may indicate prediabetes, a condition where your blood sugar levels are higher than normal but not yet in the diabetes range. This is a critical warning sign that lifestyle changes are needed to prevent diabetes. Diabetes. If your blood sugar levels remain consistently high during the test, it may suggest diabetes. Further tests may be required to confirm the diagnosis. How the test is conducted. The glucose tolerance test is a relatively simple procedure, but it does require some preparation. 1. Fasting. As mentioned earlier, fasting for a specific period before the test is essential. Your healthcare provider will give you clear instructions on when to start fasting. 1. Arrival time. You'll be scheduled for a specific time at the testing facility. Make sure to arrive on time, as the test involves several blood draws at precise intervals. 1. Glucose solution. During the test, you'll be asked to drink the glucose solution. It's important to consume it as instructed. For whom and what diseases this test is for. Diabetes screening. The glucose tolerance test is often recommended for individuals with risk factors for diabetes, such as a family history of diabetes, obesity, or a history of gestational diabetes. Gestational diabetes. Pregnant individuals are usually screened for gestational diabetes between the 24th and 28th week of pregnancy, as it can pose risks to both the mother and baby if left untreated. Polycystic ovary syndrome, PCOS. Women with PCOS, a hormonal disorder, may also undergo a glucose tolerance test because they are at increased risk of developing diabetes. Prediabetes. If you have been diagnosed with prediabetes, your healthcare provider may recommend regular glucose tolerance tests to monitor your progress and help prevent the development of diabetes. Unexplained symptoms. In some cases, when individuals experience unexplained symptoms such as excessive thirst, frequent urination, or unexplained weight loss, a glucose tolerance test can help determine if diabetes is the cause. Conclusion. The glucose tolerance test is a valuable tool in diagnosing and managing diabetes and related conditions. If you have concerns about your blood sugar levels or have risk factors for diabetes, consult with your healthcare provider. They can determine if a glucose tolerance test is appropriate for you and provide guidance on how to prepare for the test. Early detection and proper management of blood sugar levels are essential for maintaining good health and preventing diabetes-related complications. Your health matters for us. We are Quali.Health. If you want to effectively protect your health, get your all-access health pass at www.quali.health. Our health skills provide valuable information and guidance on specific health conditions.